Good morning. My name is Brad Arthur, and I'm an independent community pharmacy owner here in Buffalo, New York. I began my career in 1987 after completing pharmacy school, and since that time I've worked at a neighborhood independent community pharmacy. We've been very fortunate to be able to provide services in Northwest Buffalo for over 50 years now, and it's been a privilege for me to be able to serve that community. In the chapter that I am covering today on visible patient-centered care, I think it particularly rang home for me because if you were to ask me early in my career, my opinions about the role of pharmacists may be different than they are today, and particularly as it relates to, some of the core fundamental functions that I think we as pharmacists provide. I think the question that I would ask anyone considering entering the profession or those that are in the profession is, what is the real underlying reason why they chose pharmacy and why pharmacy is a fulfilling career for them? And I think for me, an important component of that answer should be a genuine concern for the patient. If you go home at the end of the day and you ask yourself, did I truly help anyone, or did I contribute to someone's wellness and improve their health care today, then I've done my job as a pharmacist. How you define providing that care can be done and accomplished in many different ways. I think now today we have to understand that providing that care entails involving the family, for example, involving other stakeholders, physicians, other providers. It could involve caregivers in the home because there are many obstacles that patients face with respect to their own care. And I think to the extent that we can remove those obstacles and barriers and make them a more active participant in their care, we will improve the outcomes for them and improve also their circumstances and their relationships and their family and their perception of how they fit into their family dynamic, where their health has been the primary focus. So pharmacy plays a very integral role in that. Pharmacists are the most accessible practitioners often, so patients come in and they have access, but there are barriers there. There are barriers that are perceived and some that are real. Some of the perceived barriers are that the pharmacist is either too busy, or folks have trouble identifying who in fact the pharmacist is. So it's important that we as professionals conduct ourselves and our appearance in such a manner that people can clearly identify who we are in our particular operation. And then once we've been able to do that, we begin to develop what I think is a second core competency in the patient-centered care approach, which is developing trust. I think to the extent that a patient can achieve that trust with whomever they're receiving care from, it will go a tremendous way in ensuring that the outcomes of that treatment are achieved. And to the extent that pharmacists embrace that role, trust can sometimes be a very important factor in making certain that's accomplished. Trust can be developed by improving communications, making oneself accessible, and again, bringing in other components of the healthcare providing team on behalf of the family. I think that's a very, very critical role, because once trust is established, then patients will feel more free to address some of the other obstacles that they have, such as communication issues. Sometimes I happen to practice in an area where there's a very diverse population, and I think sometimes people acknowledge that they understand something, and in reality they don't fully understand it. So treatment is sometimes interrupted or not fully utilized. So trust helps to bridge that gap, and being able to work in the same environment for a prolonged period of time as I have has allowed me to develop that trust over years. And I can work with patients and ensure that they're getting the best possible treatment. There are a few other things that I wanted to touch on in Chapter 5. Patient-centered care also is predicated on a coordination of efforts on behalf of all of the stakeholders involved. Oftentimes miscommunication results in gaps in treatment, and these gaps in treatment leave patients feeling unsatisfied or left with more questions about their particular condition. I think what our primary role is to provide solutions to people's problems, and that could come in the form of education and sometimes being able to direct people into the most appropriate places for solutions to their problems. One of the other things I think is critical is that we always recognize that the patient is the central focus point of all of our efforts. I think once we begin to recognize that, I think we can be much more effective pharmacists. The chapter refers to the term the good pharmacist. I think it's important for us to recognize, what is it that we hope to get out of our chosen profession? Do we merely want to be purveyors of a product, or do you want to be truly invested in your community? And I can say the most satisfaction that I get individually as a pharmacist is being able to make a change in the lives of those people that I take care of. So the patient-centered care is a very critical component. I think sometimes what happens is we get distracted by all of the other things that are going on in pharmacy care right now, and to the extent that it affects me as a community pharmacist, we can allow those things to become overwhelming, but you have to take a step back and ask yourself, what is it truly that I want to do in my community? And I think that's where the fulfilling part really comes in. I think there's also a recognition that the practice of pharmacy has really evolved over time. Less than a century ago, the practice of pharmacy was really defined by the artistry, if you will, of being able to compound particular medications on behalf of patients. Obviously, that's changed, and now the practice of pharmacy is really one in which we are oftentimes advocates on behalf of patients. We are resource centers, we are educators, but underneath that all, we have to show and exhibit empathy and recognize that the patient is in a position somewhat powerless because of a lack of understanding. Sometimes in healthcare we use terms that are unfamiliar to the layperson, so to the extent that we can disarm them and use terms that they can understand and personalize, I think these will be things that will go a long way in ensuring that we are a good pharmacist. Oftentimes, I think patients don't necessarily feel as though the pharmacist is an accessible source. Even though we are in communities, the pharmacists sometimes present themselves such that there are barriers because of activity in the pharmacy department, or it's just too busy, or even body language. I think we need to sit back and ask ourselves, are we truly available to those that we serve? Do we make eye contact with individuals? Have we taken efforts to extend a helping hand beyond the pharmacy department? I think the approach that I've taken in my particular store is that it's a blessing that I'm able to serve that community for 5 decades, and they've allowed me to do that, and the responsibility I have is to make myself available to them, as an individual on a very personal level, because back to the issue of trust, I think trust will be solidified if I can interact with people more on a personal basis. I think in Chapter 5, one of the things that really struck me, which was quite poignant, was professor asked a group of pharmacy students, what their definition of a good pharmacist is, or what is patient-centered care, and it took a little while, but one of the students chimed in and said, caring. I mean, I like to think if that person on the other side of the counter was a family member of mine, how would I want them to be treated? And I think it's a lesson that we have in life, and it's a lesson that we should carry through to our chosen profession, that every individual across that counter is someone's husband, someone's wife, it's their child, it's their parent, it's some loved one in their life, and they are there looking to you for answers and relying on your expertise to provide them with the solutions that they need in order to lead a more healthy and fulfilling lifestyle. So it's been a pleasure, and I am very grateful to be a member of this fraternity of pharmacist practitioners, and I strive every day to try to improve the outcomes of my patients and develop that trust, which I think is so critical to being a good pharmacist today. Thank you.